Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Friday, May the 8th, 2020. My name is John Bradford. I'm your briefing call moderator. We've been doing these now for 7 full weeks, 3 days a week. I'm a small business owner. I have 2 businesses that are headquartered right here in North Mecklenburg, about 40 employees between the 2 companies. So I've been a real job creator for our area. And I'm also a former member of the North Carolina House of Representatives. The purpose of these calls, the reason I started these, was to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to help update, educate, and support the North Mecklenburg region during the outbreak. As we start to return to work, a lot of businesses, we'll talk about phase 1, but some more businesses are opening. And so there's some CDC guidance out for cleaning and disinfecting public spaces, workplaces, businesses, schools, and homes. The point of this is you need to develop your plan to determine what needs to be cleaned, then you need to implement your plan, and then maintain and revise that plan. The idea of this is if you put this 1, 2, 3 step plan in place, then you're going to do the best you can to minimize the spread of the coronavirus. This is good guidance, especially for business owners and other public spaces, schools and things like that, daycares. And so I just want to make sure we share this. This is from the CDC. These numbers just came out. These are updated 11 a.m. Today, May the 8th, there's been 13,868 confirmed laboratory cases in North Carolina. It's about 527 deaths. That's up from 477 deaths that were reported on Wednesday. The hospitalization, believe it or not, it looks like it's dropped by 1. So there's 515 currently hospitalized. That's down 1 from Wednesday at 516. And the number of counties, we have 100 counties in North Carolina, and there's 99 out of 100 counties impacted. I expect at some point we're going to have 100 out of 100. Right now, we still have 1 county that does not have a confirmed case. So let's talk about today. Today is May the 8th. So at 5 p.m. today, phase 1 goes into effect. Now, North Carolina, even under phase 1, still remains under a stay-at-home executive order. Now, phase 1 is projected to go from 5 p.m. today, and it will last 2 weeks. Tentatively will expire May 22nd at 5 p.m. And one would think that we would then move to phase 2. So we'll have to see if the May 22nd date holds, which I hope it does, or in fact, I wish it would be pulled sooner, quicker, honestly, because phase 2 is I think a phase when we're going to really see some big changes. But let's talk about phase 1. What does phase 1 really do? Well, it eliminates the distinction between essential and non-essential businesses. It also allows any business to open as long as it limits capacity to 50%. Now, not any business, because there are specific types of businesses that must remain closed. We'll cover that in a moment. You must screen workers for symptoms, enforce social distancing, and follow enhanced cleaning rules. All right, now, there are specific types of businesses that must remain closed. We're going to cover those just in a moment. This also expands the reasons that people are allowed to leave home so that they can visit any business that's open. So you now have other reasons to leave home. And then mass gatherings are still limited to 10 people, and large group gatherings are prohibited. However, small outdoor get-togethers that are following, the recommendations to promote social distancing, they can occur as long as you have no more than 10 people. So you can have small outdoor get-togethers of non-related people as long as they are 10 people or less. Now, so let's talk about what really stays the same and remains unchanged under phase 1, meaning, what hasn't really changed from yesterday to today, starting at 5 p.m. So we still have the statewide stay-at-home order that still remains in place all the way through phase 1. So that'll last until phase 2. Mass gatherings we just talked about are still limited, no more than 10 people. Teleworking still is encouraged. Social distancing and hand hygiene is still needs to be practiced, and staying at least 6 feet apart. People may leave their homes to obtain medical services, goods and services, engage in outdoor exercise, take care of others, or volunteer. Playgrounds still remain closed. Open retail businesses must still meet certain requirements to ensure safety of their employees and customers. And visitation at long-term care facilities, that still remains banned except for certain compassionate care situations, usually hospice type situations. So all that still remains the same of what we've been living under, even under phase 1. Now, what businesses must remain closed in phase 1? So, if you don't fall into one of these categories, then it means you can open at 50% capacity. But the businesses that must remain closed: restaurants for dine-in services. So that means the indoor dining part. You can still provide drive-through, takeout, and delivery. Dine-in services includes indoor and the patios. That's still a dine-in service. So even on an outdoor patio, that's still technically closed, but you can do drive-through, takeout, and delivery. Any personal care and grooming businesses, including barbershops, hair salons, and nail salons, they still remain closed. Health clubs, fitness centers, gyms, and other outdoor exercise facilities remain closed. This includes yoga studios, martial arts facilities, indoor trampolines, and rock climbing facilities. And then lastly, any entertainment facilities remain closed, such as performance venues, movie theaters, bowling alleys, and indoor and outdoor pools. A lot of questions about pools. Private pools, you're in your backyard, that's fair game because they're not public. These would be indoor and outdoor public pools, HOA pools or county pools or any pools that are open for profit. So what does phase one mean for camps? We have a lot of children usually go to camps. Day camps and programs for children and teens may operate only if they are in full compliance with the CDC's guidance for these programs. Day camps may not allow sports except for sports where close contact is not required. So as long as you can maintain social distancing for those sports, then it would be okay. And then any activities where campers cannot maintain at least 6 feet of distance from one another are also not allowed. If a day camp is operating within a business, a facility, or school that is closed, that has to stay closed during phase one, the actual camp can operate, but the location must otherwise remain closed to the public. So the camp within the facility can operate, but the actual business must remain closed. And overnight camps are not allowed. So overnight camps, no spending the night whatsoever under phase one. Next question, does phase one allow for people to stay at hotels or other short-term vacation rentals? And the answer is yes. Hotels and short-term vacation rentals are allowed under phase one. However, it's recommended that you still practice, social distancing, stay at home. If you go and rent something, stay home unless you have to go out to a business that's open for some reason, and other COVID-19 mitigation measures for short-term rentals are in place. And if you're a landlord, a rental landlord who has a short-term rental, you need to follow CDC guidelines on cleaning, or if you're, someone in the hospitality industry and you own a hotel, this would apply to you as well. You have to follow the CDC guidelines on cleaning hotels and rental units in between occupants. And you need to use an EPA-approved disinfectant between customers. Does phase one require North Carolinians to wear masks when outside the home? It's recommended, strongly recommended according to the guidelines, but it's not required. But what is recommended is a cloth face covering that covers your nose and mouth. I do realize, and Commissioner Coughlin, I think, has done a good job to remind everybody, there are some people who just cannot wear a mask. It could be because of mental health issues. It could be because of a disability. So do not judge others. But obviously, if you are willing to wear a mask and are capable of wearing a mask, then I think it's recommended and you should do it. But no one's forcing you to. But it's just a friendly reminder that the whole purpose of the mask is to help from transmitting it to other people. But don't judge others that aren't wearing a mask, I guess is what I want to leave upon you. These coverings, again, protect other people more than the person actually wearing the mask. And it is recommended that you wear them outdoors if you cannot stay at least 6 feet away from other people. So these are recommendations, but not requirements. What does phase one mean for schools and graduations? Well, school facilities are going to remain closed for any in-person instruction. So the physical buildings are closed for the remainder of the year. But the North Carolina Department of Public Instruction and the State Board of Education are going to continue to work to provide, health, nutrition, safety, and other well-being programs during the school closure period. And when it comes to graduation, my heart goes out to all these seniors who are graduating. Local school boards and superintendents are going to make decisions on what's best for their situation, and other end-of-year ceremonies. I know CMS has a task force; they're visiting this. So anyway, if you know a senior, just give them some extra love right now because it is a big deal. Although I will say I don't know if it's as big a deal as it is to the parents and grandparents, which was a point that was made on our last call. But it still is a rite of passage graduation, and my heart just goes out to all these seniors. What does phase one mean for childcare? Childcare facilities will be open for the children of North Carolinians who are working at a business that's not closed, or people who are out trying to seek employment. So, they need someone to watch their children while they're out looking for a job, or those who are homeless or receiving child welfare services. It is a reminder that child care facilities must follow the health and safety requirements in the executive order number 130, which specifically address this, and any of the other guidelines issued by the North Carolina Department of Health and Human Services. What does phase one mean for places of worship, for churches? Well, places of worship may hold services that exceed the mass gathering limit of 10 people if they're held outdoors, and outdoors is important because the virus is not easily spread outside because naturally it's a much large open area, and not in an enclosed space. And you must follow recommendations to promote social distancing. So if churches have big areas outside and they can spread people apart, 6 feet apart, then they can have more people than 10. So I think that's great news. Now, phase two, I'm not going to spend too much time about this, but it's tentatively going to start 5 p.m. on May 22nd. Again, this is the phase where I really think we'll start to feel big differences because the stay-at-home executive order will be lifted, although there'll be strong encouragement for the vulnerable populations to continue to stay at home. But that, of course, would just be relying on people's sense of responsibility, and you make the decision what'll be best for you. And not to create any confusion for phase one, I'm not going to cover all of these. Just know that phase two, I think, is going to be a significant improvement, and I would love phase two to get here sooner than later. Right now, it's May 22nd. But if the numbers look better before then, I hope the governor will pull that date forward because this, to me, is when we really start seeing a sense of normalcy back out there. And then phase three, which would be, of course, following phase two, is even more relaxed than phase two, right? As we progress in each phase, it's going to get more back to normal more and more. Although there'll still be some restrictions for the vulnerable, et cetera. Phase three will follow a few weeks. But right now, we should all be focused on phase one, which is why I spent so much time covering it. The 3 W's that are being recommended: wear face covering, wash your hands, and wait 6 feet apart from other people to keep your distance. If you are interested in cotton face coverings, whether you're an adult or a youth, you can go to shop.indiramills.com. You can see the website right here on the screen. $2 a mask, order a 12 dozen minimum. They will ship them to you. You pay shipping. They're a North Carolina-based company, right in Burlington. So, and I'm sure there's other companies. I'm just recommending one that started doing this. This company usually makes thermal underwear, and they pivoted and started making these face coverings. And I ordered some for my employees and for my family and friends, and they're nice. You can wash them. And they have this new youth face covering. So if you are interested in getting some of these face coverings, please order some, and shopindiramills.com is an option for you. And then just lastly, visit Lake Norman. They have a virtual tip jar. So if you want to still tip some of our hospitality workers, even in this situation, you can go there. They also have a list of any curbside listings when it comes to takeout food and delivery services for all of our restaurants in the Lake Norman area. And then if you are on Zoom calls, a lot of people are doing Zoom type calls. So it's not just limited to Zoom. You could be other types of webinars. They have some really beautiful background photos of Lake Norman. So I encourage you to go grab a background picture. And when you're on a Zoom call, be proud that you're from the Lake Norman area, and show all your colleagues on the Zoom call or whatever the call is, where you're from. And those photos will be helpful for that. And Fridays, I try to give all of our panelists a break because they're with me every Monday and Wednesday. Congressman Greg Murphy, Dr. Jack Faircloth with Atrium Health, the United States Small Business Administration Director Thomas Stith joins us every Wednesday talking about small business loans that are available. Mecklenburg County Commissioner Pat Cotham, Cornelius Mayor Woody Washam, Huntersville Mayor John Annarella. We've had Davidson Commissioner Matthew Fort join a handful of our calls. CMS board member Rhonda Cheek has also been on a handful of calls. We've had Bill Russell, the CEO of the Chamber of Commerce. He's been on every single call. And then, of course, I'm John Bradford, former North Carolina House Representative, and it's been my honor and privilege to lead these calls. Our next briefing with the panelists is going to be Monday, May the 11th. Please keep your emails coming, lkntogether@gmail.com. We are stronger together. Keep those emails coming. I really do appreciate it. And we've helped a lot of people who've reached out to me. And so I enjoy that, lkntogether@gmail.com. And I hope you'll take care of yourself, take care of each other, and we'll talk to you on Monday. This concludes today's briefing call. Thank you.